Hi, everyone. My name is Steph Hickey, and this is my presentation for our assignment on the professionalism and the future of the MFT. For my interviews, I interviewed two women. The first name is Risa. She's a licensed marriage and family therapist, and she's been licensed for a little over 15 years. And the other woman I interviewed is Tina. She's been a marriage and family therapist, a licensed marriage and family therapist for just about 4 years. So I went over the questions with them, and I'm just going to share kind of the highlights of what I got from the interviews with them. So, first, when I asked them about the challenges that they face, they both talked about the social and political climate and how that's difficult to navigate right now. Um, they also, Tina specifically shared just the difficulties in dealing with the misinformation that can be posted on social media. She specifically said that she feels like there's a lot of misinformation about diagnoses on, things like TikTok. And she said, on the one hand, while this is good because these influencers are bringing awareness to mental health issues, which again is definitely a good thing. She felt like some of these short form videos can be difficult and have a lot of people watching them, feeling as though they then have ADHD or a narcissistic personality and doing some self diagnosis because of them. The other, Risa, when I spoke with her, also said, kind of alluded to this and the navigating social media. So both mentioned that. Risa also did talk about dealing with the increase in rates of suicide in the younger population, which obviously is a very big challenge that we will be facing, and how to help those youth and address that situation. Tina also talked about this challenge that she felt, which I thought was interesting, in just distinguishing the care that we provide as an LMFT as opposed to what a licensed clinical social worker might provide, or a clinical psychologist might provide. So just um, being able to communicate to people the services that we provide and how they might differ from some of those other careers or professions that are similarly aligned. Let's see. The second question I asked was talking to them about the role that law and ethics has played in their profession. Both women talked about how the code of ethics, the AMP code of ethics, the laws, the regulations, how those have helped them maintain strong boundaries in the workforce, or in the workplace. They both also mentioned the importance of staying current with them because Risa specifically talked about how they're changing and how it's important to stay up to speed with those. Tina talked about how she really likes it. She said they create a safe environment, allowing the client to be vulnerable, and also approaching sensitive topics with the client. She kind of explained it like having those codes and those laws and those ethics helps create that safe space to be able to do that. Tina also did mention that she's been in several situations where maybe she has not totally seen eye to eye with how a clinical supervisor might have suggested moving forward with a client. And she said she felt as though considering the law and ethics in consultation in those murky situations has been invaluable. Um, so that was it for the law and ethics. I'll talk about it in a little bit, but also both of them did allude to the idea that law and ethics, having to really navigate those and making sure that they cater to a diverse population and not just seeing them, um, being able to see them from that lens, from that diverse lens. So then that kind of leads me to this one. So then I asked them about the influence of cultural awareness and cultural sensitivity in the MFT, within the MFT profession. They both, like right out of the gates, both stated the importance of being active listeners and considering the cultural and social context that clients are coming from. Um, they both felt like the field does a good job considering how culture impacts the family system. Um, Tina, I believe it was, talked about how important it is for her to really learn about the client's culture, who they are, what they believe in, what their traditions are, in order for her to develop that therapeutic relationship. Risa, again, did talk about same thing, kind of, incorporating a client's cultural practices and beliefs and staying curious and being open. And as we're always talking about, being an active listener, active learner. And then again, like I mentioned, they both talked about taking not only the codes and the laws, but also the models, and just really being able to actively apply those to a diverse population. Okay. As far as licensing and regulations, Tina brought this up, and I didn't know about this. So she said that California would be switching to a national exam in a few years. So I need to do a little bit more research on that and see. I'm so new to everything that I didn't know about that. So she talked about that and how that's going to make the license much more portable. They both talked about telehealth and just understanding all the regulations for telehealth, if that's something that we're going to go into. And then Tina specifically, I think possibly because she's the more recently licensed MFT, did talk about the process of licensing and how it's a really arduous process. She gave some great advice that I have heard before, but it was nice to hear it from her as someone who's recently gone through it. But she said to count every hour, make sure every form is filled out properly, get signatures promptly and often, scan your paperwork as a backup. She talked about how she had a friend who only had two sites and two supervisors, so the paperwork was a little bit easier. But for her, she had around seven supervisors across four sites between her pre-graduate and her associate journey. So just the process, she stressed the importance of us as trainees and associates staying organized and just really staying on top of that licensing process. So I thought that that was very helpful. Let's see, as far as the challenges, they talked about a lot of the things that I would have expected, but again, it was nice to be talking to people coming from such different backgrounds, just in who they see and the clients they work with, and just their years of experience. They both talked about this issue of burnout, and we have talked about this, I know, in class before, but this idea that, where I'm sitting to where Risa with 15 plus years is sitting, just the years and years of not only these early years of getting licensed and going through all of the regulations and the hours and things like that, but just how as a career, how it can be difficult to hold that safe space for clients and to also balance that with our continuing education, our training, and our self-care. So they both talked a lot about this idea of burnout. And then again, Tina, being the newer LMFT, did again talk about this journey and how the journey can be very challenging, that journey from a trainee to an associate to licensing. Um, she said, which I thought was interesting, associate therapists are still learning professional boundaries, feeling out different modalities, and working under a supervisor. They're logging hours, doing all of that, combined with trying to figure out how to care for themselves while also holding space for people's pain and struggles. And just talking to her about that was really helpful for me because I felt like this is something that I think about a lot and what steps I can take to maintain that balance. to make sure that I stay, um, just mentally healthy and able to help my clients and also take care of myself. Um, and then she did just talk about, um, learning to put things into practice. So after all the education, after all the learning about the theories, learning about the models, that it can be challenging, like we've already mentioned, to work with clients from all different backgrounds, all different situations, and really getting that experience and being able to put everything that we've learned into practice. So I thought that was really helpful to hear from her. So then let's see. So for both of them, we talked about my final question for them was to talk about the future of the MFT as a profession. They both felt optimistic about it. They both felt like, even in spite of the challenges that an MFT faces, that society is, as a whole, is becoming more open to therapy, and because of that, the demand is getting higher. So there's definitely a need for us as MFTs. Risa talked about that she thinks it would be really good to incorporate that somatic healing and really incorporating therapies that address the body and the mind, which kind of leads me to the integrative care systems and um, just like getting excited about the option of integrative care systems, but also understanding that the complexities of that, the challenge of that, dealing with clients from all different backgrounds, trying to incorporate and integrate their care. To me, I think it's super exciting, and I think it's a really cool future for MFTs. But I do understand that it's got a lot more to it. Um, they both also talked about just in the future, not that it's more important to be sensitive and aware, but just because they kind of talked about, because more people are becoming open to therapy, people from different backgrounds, people from different cultures, which is awesome. Um, some of that stigma is slowly starting to kind of be reduced, but then for in the future, just keeping that in mind and understanding then how important it is for us that if somebody has taken the risk to come see us, and maybe in their culture this is kind of stigmatized, if they've actually come to see us, then making sure that we are sensitive and aware when we are working with them, and not just doing a one size fits all approach as far as the models. I thought it was also interesting, Tina talked about the use of AI in therapy, and I hadn't thought of this, but I thought it was kind of interesting. She said that um, not only herself, but some of her fellow therapists have really maximized AI and used it to create tools for assessment and tools for evaluating different things within sessions, which I had not even thought of, but I think is really cool. Um, and then so she talks about, she mentioned she thinks that AI will make the future very interesting for MFTs, not only in creating these tools, but she also talked about how teens can use AI to seek reassurance. So she was saying just how a lot of places now are kind of starting to incorporate this into um, platforms or things that teens can use in helping them with their mental health. So again, like I said, hadn't even thought of AI in the future, but I think it's important to do that. And again, just it was really interesting to talk to these two people. I didn't realize how much I would get out of it and how much it would help me to talk to two people who are out there doing it, and to hear some of their concerns, to hear them talk about their challenges, but then also, like I said, just to have such a hopeful view about being able to work with people and being able to help so much during a time where, um, like I said in the very beginning, the social and political climate now really I think necessitates a lot of people to find that balance and to reach out for mental health treatment if they feel as though they need it. So I appreciated the assignment and really enjoyed talking to them about, incorporating laws and ethics and incorporating those and applying those to diverse populations and the need to do that and how important it is to do that while we continue to grow as a profession. So I enjoyed the assignment and I appreciate you taking the time to listen. Thank you.